test, 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 test,
Hello, Dr. Lucy here.
Good morning, ma'am. Yes, ma'am, I'm here.
Please share your screen.
Yes, yes.
Just sharing, ma'am.
Yes. And change your name also. You are showing as Orunima Chaudhary.
Why it is showing as Arunima Chaudhary, I don't know, ma'am.
Please change it. So that everybody else was showing Orunima Chaudhary.
Achha, everyone was saying, okay.
Yes, yes, yes.
I have changed now.
Please share the screen. We will go online.
I'm sharing.
4 minutes, please.
Is it visible?
Yes. Slide share mode, please.
Okay.
Move on to slides. Yes. You can stop sharing.
Thank you very much.
Stop sharing, madam.
Sure. Yeah, ready.
By what time we are going to start our sessions, ma'am?
9:30.
Okay, 9:30.
In 2 minutes.
Yeah, sure, ma'am. Mine is second one, na?
Yes.
Okay.
Is my screen visible?
Yes.
Okay, perfect. Please let me know when to start. Okay, ma'am. Madam, shall I start? Hello.
Hi, yes. Yes.
Good morning. A warm welcome to our session on medical education. There will be 6 presentations in this session. The traditional role of a teacher has been to act as a source of information and to transmit this information to the learner. With a recent emphasis on the act active role of the learner, the role of a teacher has changed, and overall responsibility and functions in the educational process have increased tremendously. It is managerial function, teacher as a communicator, teacher as a self-learner, research worker, role model, and many more roles to go. I will be the first presenter from Bardhaman Medical College. Next will be Dr. Arati. She's from Department of Anatomy. She's from Haryana. Then Professor Ashitaba Debray, followed by Dr. Kaushik Mitro and Dr. Kiran Kumar Ganji. He is from Saudi Arabia. And Dr. Kartika. She is from Jipman, Pondicherry. This will be the proceedings of our session. Now I will start with my presentation. Qualitative research, a powerful method to inform evidence-based practice in medical education. Objectives. By the end of the sessions, the learners will be able to discuss 6 common types of qualitative research designs, describe the most important features of these 6 types of designs, recall the disciplines associated with some of the various qualitative research designs, identify the most common qualitative designs reported in the medical education research literature, critique the design sections of qualitative research studies. Life cycle of research. First comes the identify data needs. Spell out the research question. Formulate the study objectives. Plan the analysis. Prepare data collection instruments. Collect data. Analyze data. Draw conclusions. Formulate recommendation. Inform stakeholders. 3 steps for choosing an appropriate qualitative research design. First step is to identify key research ideas. Start with identifying the specific components of the problem and purpose statements. The second step is identify key research design features. And the third step is match research ideas with the research design. For identification of key research ideas, first start with identifying the specific components of the problem and purpose statements. Choose a sentence that succinctly describes the problem and what the researcher hopes to learn through the research. State who the participants will be and describe the scope or depth of knowledge. Let's see an example. Problem. Despite district and school level strategies, there is a high rate of teacher turnover in medical colleges or schools of the district XYZ. What to know? What experiences are contributing to teachers' desires to remain or leave the school or district? Participants, new and veteran teachers from the school district. Depth of knowledge. I am looking at one district, so I want representation from every medical school in the district. Now let's come to the identify key research design features. Knowing the key research design features is a critical step in choosing a design that matches your research plan. It is important to keep in mind that each research design is complex and varied, with many researchers adding to and refining the designs. We should look into the primary aim of the design, the sample size, and the data collection methods. Next comes the matching ideas with research design. After reviewing the key research design features of several research designs, it should be clear which design is most appropriate for the research. For example, in the above case that we have already discussed, a case study design would be the most appropriate based on the key research ideas because the problem can be addressed at multiple levels, district or school level. which fits well by bounding the cases as a single case with embedded units of analysis, district level or multiple case designs, school level. Exploring one district's new and veteran teachers' experience, contributing to their decision regarding remaining or leaving a medical school or district fits the case study with attention to the context. Wanting to explore teachers' experience in depth, it will be better to seek at least one teacher from every school. Having two from every medical school, one new and one veteran teacher would be ideal. So this is the AMAE research compass: modeling, justifying, predicting, and implementing. For explorative research, there are descriptive, qual, and psychometric studies. For observational, there is case control, cohort, cross-sectional, associational studies. For experimental, there is RCT. And for translational studies, there is efficiency study guidelines. Before constructing a qualitative study, a researcher must first know the approach and intention for the research. Qualitative research methods vary drastically from quantitative research methods. Guidelines for critiquing qualitative research design. Does the phenomena lend itself to study by qualitative methods, or would a quantitative approach would have been appropriate? Does the study focus on the subjective nature of human experience? Is the specific qualitative approach named and described? Will the study findings have significance in medical education? Does the researcher clearly describe how participants were selected? How was the sample size determined? Is the data collection and recording process fully presented? Is it clear how researcher bias in data collection was avoided? Is the data analysis method consistent with the purpose and approach of the study? Are the study findings clearly presented and study limitations acknowledged? Are suggestions made for further research based on the study findings? Now let's see about some qualitative research method. Interview. Researchers can conduct in-depth face-to-face interviews with participants. This allows them to gain insights from the participants to best understand their experience. Next comes the focus group. Focus groups are similar to interviews but involve multiple participants at once. They are another route to obtaining responses and making interview observations. Observation, a less direct method than interviews or focus group. This method requires careful attention to participants' activities and behaviors in order to gather data. Document analysis, researchers can gather useful data from print documents as well as electronic records. Careful analysis is needed to draw conclusions from the body of related documents. Now let us see something about interpretive phenomenological analysis. Imagine waking up on your first day at medical school away from home. You open your eyes, look around your new room. It is a sunny day, so you set out to explore the campus. You have been looking forward to joining medical college for a long time. You arrived late last night. It was dark, and you went straight to your room. So this is your first day as a medical student. So what it is like? So how do you realize your new time in the school? Can you describe that feeling? What it is doing to you physically? What thoughts come to your mind? How does it relate to what you expected? Now describe your walk around the campus, looking at the buildings, working out how to find out the library, eating at the cafeteria, watching other students and academics, and talking to some of them. The experience of your first day at medical college or school is an example of a topic suitable to be investigated using interpretative phenomenological analysis, IPA. An IPA design is appropriate if the researcher focuses on the meaning of the individual experiences, and then the researcher interprets what these meanings entail for the participants. This double focus in IPA designs required the researcher to focus on detail, resulting in small sample size. Example 1 to 10. Semi-structured interviews are the primary means of collecting data for doctoral dissertations. A case study design is appropriate if the researcher focuses on one of the two main aims: understanding individual participants' perspective and experiences related to a phenomena. Understanding a phenomena based on a group of participants' perspective and experiences with a phenomena. A critical feature of case study design is the idea of case boundaries, which brings attention to context and its role in people's meaning making. Sample size 1 to 10 are typical because of multiple data collection methods, including interviews, observation, artifacts, documents. A narrative design is appropriate if the researcher explores people's lived narratives related to a phenomena or event, or researcher uses narrative analysis methods on a data set. Narrative researchers search for stored experience that include personal and social perspective, inherent histories, present experience, future possibilities, the situations associated with the experience. So again, the sample size can be 1 to 6. Data collection is in-depth and includes interviews, observation, and artifacts and documents. Qualitative research is subjective in nature. Methods are designed to understand the lives of participants. The process is maintained on neutral lines without placing judgment on individual responses. Focus areas are cultures, societies, and individuals. Ethnography. One of the most popular methods of qualitative research involves the researcher embedding himself or herself into daily routine or daily life of subjects, either as an active participant or as an observer. The researcher experiences their customs, traditions, mannerisms, and reaction to situations. First time sometimes takes for years. Geographical constant could be a hindrance for the researcher. Example of application. This on-the-field method can help community health personnel assess how a certain community uses certain products or services and accordingly develop new strategies or revamp existing methods that can be used in medical education research in family adoption programs. Narrative. In the narrative method of qualitative researcher, the researcher gathers data and facts from 1 or 2 subjects through interviews, documents, etc. over time. Now let's come to an example. Community health doctors or medical education researchers involved in community medicine can use this method to understand challenges faced by the target audience that can be utilized for innovation and development of strategies in healthcare system and policies. Phenomenology. The phenomenology qualitative research method is used to study an event or activity as it happens from various angles, using interviews, videos, on-site visits, etc. It is primarily an experience or perception based on research method. Example, medical universities can rely on this method to understand how students make their choices about applying to universities and colleges. Now comes the grounded theory. Grounded theory starts with a question or collection of data. Through systematic data collection analysis, repetitive ideas or elements are coded. New theories may be formed based on these categories. Example, medical education researchers from an institution can use this method to understand how their students use mock courses or the individual features of these courses. Case study. The case study method is used to gather in-depth, detailed information about a subject, which could be an entity, organization, event, or something larger like a country. Example, for providing community health services, case studies are a useful tool to formulate strategies, understand influences, devices, new methods. This can be embedded in medical education research during community visits of medical students and residents. Action research. In this type of qualitative research that seek action to improve practice and study the effects of the action that was taken. Solutions are sought to practice problems in one particular hospital or healthcare setting. There is no goal of trying to generalize the findings of the study. In action research, the implementation of solution occurs as an actual part of the research process. There is no delay in implementation of the solutions. Action research was used in London in a nursing home. The purpose of the study was to identify facilitators and barriers to the use of palliative care outcome. The staff took part in semi-structured interviews, completed diaries, and participated in monthly meetings to give their opinions and what they thought were the facilitators and barriers to the implementation of the palliative care outcomes. Action research was conducted to promote medical students' motivation in an English for specific purposes classes by Dhanan et al. In 2013. The purpose of this study was to tackle the problem of students' low motivation in English classes. Accordingly, the syllabus was modified and the teaching learning methods were also modified to change the attitude of the students. Data was collected through interviews with both teachers and students to determine the changes to be made in the syllabus. Action research. The medical students of a medical college are attending lecture classes in a medical institution. The purpose of the study may be to identify facilitators and barriers to attending lecture classes. The faculty members can take part in semi-structured interviews, complete diaries, participate in weekly or monthly meetings to give their opinions on what they thought were the facilitators and barriers, and modifications can be made accordingly. Thank you. With this, I come to an end of my presentation. Our next presenter will be Dr. Aarti. Over to Dr. Aarti for her presentation. Thank you.
Thank you, Dr. Arunima, for providing the opportunity as well as for such a elusive presentation.
Thank you, ma'am.
My topic for the presentation in this conference is significance of ATCOM in medical education, concept and implementation. So when this concept of ATCOM was introduced, that raised a question for the doctors. When we were doctors, we considered ourselves only as doctors. The question raised was, are we doctor professionals? so that professionalism course or professionalism teaching can be introduced to them. So we went into the definition, into the depth. A professional is the one who is committed to excellence, who is ethical, responsive, and accountable to patients, community, and towards his profession. So that clearly says that being a doctor, we are all professionalism. And professional is so integral and intrinsic to the medical profession, it should be the explicit part of the curriculum. Making of a medical professional is a complex task and essentially requires a combination of a number of activities for transforming young medical student into a competent healthcare professional. So for that matter, in 2019, when CBME was introduced in India, the Medical Council of India also introduced Attitude, Ethics and Communication booklet as in the form of a module. The reason for introducing ATCOM was there were rising incidences of the physical assault. There is rising violence against the doctors, and the relationship between the doctors and the patients is continuously evolving, keeping the dignity and the safety of the doctors at a stake nowadays. So the reasons were found out why this is happening. So it is not only because of because from the end of the community, it was also observed that laws cannot stop the attacks on the doctors. We need to focus on fixing the healthcare gaps. So we just tried to introspect and thought that there could be some improvements which are required now in the education of the doctors so that all these things can be stopped. So the need of the ATCOM is because we have to make an Indian medical graduate, which is globally relevant physician of the first contact of the community, which is having specific qualities. So one must realize that the successful implementation of the program will not only aid in the provision of comprehensive healthcare, but it will also minimize the risk of negligence from the health sector and any unethical practices. So the purpose was to stop the unethical practices or to minimize the unethical practices, if any, and to reduce the risk of negligence from the side of the doctors. Graduate Medical Education Regulation 2019, it says the role of GMER is to prepare IMG, and IMG is having 5 identified roles. And if we name them, these are clinician, leader and a member of healthcare team, communicator, lifelong learner, and the professional. But when we have these 5 clearly defined roles of an IMG, again, where we can fit in the ATCOM over here. So we can say clinician is having the roles of preventive, promotive, curative, palliative, and holistic care with compassion. Leader and the member of healthcare team must have the empathy, must demonstrate empathy. Communicator is patients, families. Communicator has to communicate with patients, families, colleagues, and community. So role of communication is important. And professional is having responsive, accountable, and ethical values. And lifelong learner is having the continuous improvement in above stated skills. So in all the roles identified in IMG, there is some component of attitude, ethics, and communication. So in order to effectively fulfill the mentioned roles, the IMG must obtain a set of competencies at the time of the graduation. Now the question is, did the students not learn the professional ethics in medical college previously? Yes, they do learn this behavior. We all have learned this behavior. We all have been trained by the traditional curriculum for our ethical values. But where lies the problem? Problem is, or I should say, the professional ethics, it was being learned with the help of a hidden curriculum. We are just observing the teachers or the peers. We all have our favorite teachers. When we close our eyes, we have a role model. We memorize some good qualities, and we have some people in the mind that we don't want to be like them. So it is more or less the personal perspective, and we are growing with the help of just the hidden curriculum. And the phenomena is more or less, we can say, like father, like son. So we are having some of the qualities of our good teachers, and we are avoiding some of the qualities which we did not like in some of our teachers. So, hidden curriculum consists of those things the students learn through the experience of attending college rather than stated educational objectives of such institutions. So, in the prevalence of both the negatives and positive qualities, the teaching and learning of the medical ethics, behavioral science, and communication skills and managerial skills as well, they have not received due attention in the traditional medical curriculum. So, there is a need for the paradigm shift. And in order to ensure that training is in alignment with the goals and competencies, a structured longitudinal program on ATCOM or Attitude, Ethics and Communication has been introduced. So we have been the part of educational reform, and we being the teachers have been given the chance to change. So the ATCOM module addresses the heart and emotions, and it stresses on the development of proper attitude, communication skills, and it enables the medical graduates to practice ethically in a real world scenario. So now the time is the curriculum which was hidden, that was implicit, now it has become explicit. So we come back again as professionalism so intrinsic and integral to the medical profession, it should be an explicit part of the curriculum. So ATCOM, what has ATCOM done is it has uncovered the hidden curriculum. Another important thing is that why the students should learn ATCOM. It is well known that what is not assessed is not valued by the student. So ATCOM is designed in such a manner that assessment has also been planned so that students understand the importance of ATCOM, and in their mind that it is need to be assessed, so they tend to learn it in a better way or in a more effective way. So ATCOM module is basically a conceptual framework. It is to help the institutions and faculty to develop and to implement a longitudinal program which is running throughout all the phases. It has competencies in attitude, ethics, and communication, and it is to be used across all the professional years, and it is to be taught by faculty from all the subjects. It is not that we need to have some special faculty who is coming and teaching the ATCOM. All the faculty is involved in teaching of the ATCOM, so it is basically the forerunner of the competency-based module. How were we teaching the ATCOM? With the help, where basically the professionalism was taught with the help of role modeling and mentoring, but now the explicit teaching is important. It has gained its importance, and we need to provide the opportunities for experiential learning and reflection to the students. So what is there in this ATCOM booklet? What is the structure, content, and its requirements? It is basically a guide to facilitate the institutions and faculty. For what? For implementing a longitudinal program that is going to help the students to acquire necessary competence in attitudinal and communication domains. This document is divided into various parts, and it is having multiple modules for all the phases. Phase 1, it is having the 5 modules and 34 hours being allotted to it. For phase 2, 8 modules are there, and number of hours allotted were 37. For phase 3, we have 5 modules and number of hours are 25. Phase 4, we have 9 modules and number of hours are 44. These number of hours are varying depending upon the updated guidelines which are coming regularly from National Medical Council. These hours which I have stated in this slide are from 2019, but now from the feedback from the faculty, the hours are continuously changing. So we need to be updated for that also. So this is how the booklet is being designed. It is having section 1, which tells the goals, roles, and competencies of IMG. Section 2 is telling us all the modules. Section 3 tells us about the competency acquisition. Section 4 tells about the formative elements which are to be marked by the tutor. Then we have some rating tools in the form of appendix. Now, the competencies have been divided into 2 types, the core and non-core competencies. Core competencies are basically the must-know competencies, and non-core competencies are basically desired to know, or it would be nice to know competencies. Core competencies are 39 and non-core are 15. And it is dealing with the multiple domains, and some competencies they span over the entire curriculum, depending upon the objectives in every phase. So this is how the competencies are given. 1 to 39 are core competencies, which are must for all IMGs. 40 to 54 are non-core competencies, which is desirable for above average IMGs. And 55 to 68 are desirable traits, which are nice traits to value and practice for outstanding IMGs. But now the question arises, should not we try to achieve these all in our graduates? Is there any competency of ATCOM which is only desirable? So I feel that all the competencies must be taught as the core competencies because it is the most important domain for when the doctors are dealing with the patients. So this is the appendix which is telling us the competency and its level and domain of learning. So from 1 to 54, we have the competency. And one competency is having multiple objectives and it is spread over all the phases and it is categorized into various domains and levels. And it extends from simple knowledge and understanding to a more complex and professional attributes as a physician of first contact. For example, if we have a look on this 54 number competency, which says administer informed consent and appropriately addresses the patient queries to a patient being enrolled in a research protocol in a simulated environment. So it involves multiple things. One thing is doctor must be able to administer informed consent. He must be appropriately addressing the patient queries. Over here, the patient is enrolled in a research protocol, so there is some difference. And again, simulated environment is another thing. So there are multiple components. And to learn this competency in the final year, there must be acquisition of some of the competences in first year, phase 1, phase 2, phase 3. So overall, it is a longitudinal program and it deals with, for example, this competency deals with skill domain and level of learning. It shows how. So to develop that skill, the student must have acquired the other domains related to this competencies. And the various domains are knowledge, skill, attitude, and communication. And the level of competencies are K means knows, that is only a knowledge attribute. KH is knows how, which is a bit higher level of knowledge that is able to discuss or analyze. Shows is a skill attribute. Shows how is again a skill attribute, but is able to interpret and demonstrate. Performs under supervision or independently, that is mastery of level of competence. So we want our students to attain the reach of performance when we are talking of ATCOM. Now, what should be taught and learned? Important is when we are teaching, first we need to learn those things, then only we will be able to teach the components of attitude, ethics, decision making, empathy, and communication. Now comes when and where ATCOM should be taught. ATCOM is basically explicitly woven into the fabric of entire undergraduate curriculum and also the postgraduate curriculum. And it is a stepwise approach and continuity and incremental approach in teaching and assessing professionalism in medical school is important. So initially, a strong cognitive base, a stage-appropriate educational activities should be devised. And faculty must also utilize the opportunities at workplace to reinforce the correct behavior and allow the students to practice what they have learned during the formal training sessions in professionalism. How it should be taught? It should be taught by the personal instincts which are revolving around the motivation, observation of role models, continued stimulus to be thinking about those aspects, feedback, reflection and reflective practices, and extrinsic motivation. Now, at the end, what should be the strategies to teach ATCOM? Important is we cannot directly reach to the skill or the perform level of learning. So first of all, there must be sensitization. That is, we need to orient the students to the concept of professionalism and its importance. Then expose them to the situation that force them to think on these lines. That is immersive learning. And then at the end, we must provide time and opportunities for reflection. So I feel by this, we will be able to reach to a place where we have doctors who are perfect in their attitude, ethical, and communication skills. So what we need to do is do what is right not what is easy. Thank you so much.
Thank you, madam, for your wonderful presentation. Over to Professor Asitab Devray for his presentation, please. Dr. Asitab, over to you.
Yes, madam. Thank you. I'm just sharing my screen. Is it visible, madam?
Yes, visible. Slide share mode, please. And there is a floating panel in the upper part. So,
Yeah, I'll just remove it. Is it okay now?
in the middle, there is a floating panel. Yes, it is okay now.
Okay.
Start, please.
Okay. Thank you so much. Good morning, everybody. So, the topic of my presentation today is Unleashing Creativity in Medical Education, exploring the impact of humanities on the learning outcomes of medical undergraduate students. I thank Dr. Arunima Chaudhary, madam, for giving me this opportunity to speak on this platform. So, to begin the topic, we all know that textbooks, clinical rotations, and didactic lectures have historically been the mainstays of medical education. In this era of digitalization,
Sir, yes,
using
voice is
cutting-edge
breaking.
teaching techniques has become essential to provide comprehensive education to the students and to cater to their variety of learning styles. Can you hear me now, ma'am?
Yes. Yes.
Yes,
Am
we
I
can hear
audible?
you. Yes, you are audible. Continue,
Okay.
please.
So also while patient care needs to be prioritized, understanding the patient is as important as treating the disease itself. This calls for stressing the importance of psychological and emotional comfort along with physical well-being, leading to a holistic healing process. So, the new curriculum introduced by the National Medical Commission in 2019 stressed on a more holistic development of a medical student by incorporation of a module called the ATCOM module, as spoken by my learned colleague Dr. Aarti Madam just now. The need of training the medical students in these domains were perceived probably because the society and the community at large felt that the doctors are losing their professionalism, empathy, and communication skills over time. Literature also has reported that medical professionals are negligent of important soft skills like empathy, work ethics, communication, professionalism, and relational skills in the field of medicine. So, primarily, the objectives of the presentation was to examine the impact of film and media on the academic performance of medical undergraduates, to assess the influence of creative arts on the development of empathy and communication skills among medical students, and to explore the potential of these mediums in enhancing the critical thinking and problem solving abilities in medical education. So, basically, the idea was to find out to address these objectives with the help of a review of literature. So, by doing this review of literature, I have seen that cinema in medical education can be used as one of the most effective, essential, influential, and creative tool to educate the medical students and healthcare professionals regarding importance of soft skills in medical field. In addition, such educational modes are necessary to prevent one from losing touch with the real world. Cine education is defined as the art of using movies, trigger films, movie clips, whole length film, and theater in teaching, while the term cine education was first coined by Alexander et al. in 1994, which refers to the use of these to educate the medical students and residents about the psychosocial aspects of medicine. Movies have also been used by many faculty members in several fields like by family medicine, clinical pharmacology, and postgraduate psychiatry. The emergence of digital media, encompassing virtual reality apps, online courses, and podcasts, has fundamentally altered the terrain of medical education. Students can now interact with simulated procedures, real world case studies, and diagnostic issues through these interactive platforms. Studies show that digital media exposure to a variety of clinical contexts enhances the diagnostic precision and clinical reasoning abilities, as per Choi et al. In 2019. It has also been seen that paintings and sculptures are examples of visual arts that foster observational abilities and improve the capacity to identify minute features in patient presentations. Only yesterday, I was going through a newspaper article where a pediatric surgeon has painted poetries, beautiful paintings on R.N. Tagore's poetries to teach medical students and apply his knowledge on medical humanities. Performing arts, on the other hand, support the growth of empathy in communication through activities like role playing and drama. Role plays, as we all know, can help the students to conceptualize their roles in an act and to improve their professional and interprofessional behaviors. This also forms a very good foundation in teaching of ATCOM, as Aarti Madam has already mentioned. Theatre and drama are known to stimulate and to act as therapy. These help the students to develop a deeper understanding of the human side of medicine by including them in the artistic interpretation of healthcare events. The role of theatre in developing learners' competencies in different domains have been elaborated by many studies by different authors at different times, like Keskinis in 2017, Unalan in 2009, Ivory in 2016, and likewise. But what has been the research gap? So, while the literature provides invaluable insights, there remains a gap in understanding the specific nuances of how film, media, and creative arts impact the various learning outcomes in medical undergraduates with respect to the new curriculum which has been proposed in 2019. Also, the existing research often focuses on specific aspects such as empathy or communication skills, leaving room for a more comprehensive exploration of the overall academic and personal development of the medical undergraduates. Also, standardizing assessments for the skills in medical humanities and overcoming potential biases in the self-reported evaluations are ongoing considerations. So these are the research gaps. And we can address this by a theoretical framework where we can adopt drawing concepts from educational theories like emphasizing experiential learning, cognitive engagement, and role of emotions in learning. Constructivism, in particular, guide the exploration of how film, media, and creative arts can serve as tools for creating meaningful learning experiences that go beyond the traditional didactic approaches. So, future studies can be based on methodologies like a mixed method approach combining quantitative assessments of academic performance with qualitative analysis of students' experiences and perceptions. We can have film screenings, interactive art sessions, and reflective assignments, which will be integrated into the medical curriculum over a defined period. And then surveys, interviews, and academic assessments may be used to collect data. Expected outcomes are improved academic performance and experiential learning among students exposed to film media, enhanced reflective behavior in students participating in creative arts, and positive correlation between engagement with film media and creative arts and their improved clinical abilities. To conclude, the study seeks to contribute to the growing body of knowledge on innovative teaching learning approaches in medical education, and by understanding the nuanced effects of film, media, and creative arts, educators and institutions can foster a new generation of healthcare professionals equipped with not only scientific knowledge but also appropriate soft skills. This is one of a very good web series, The Good Doctor, one of my favorites, which actually touches upon the subtle points of medical humanities. A very good web series to teach AdCom. So I always refer to this web series whenever I'm teaching the AdCom skills to the students, whenever I'm discussing medical humanities. So I thought I would mention this web series during my presentation. So these are my references. Thank you very much.
Thank you, Dr. Ashita Devrai, for your wonderful presentation. Over to Dr. Kaushik for his presentation. Dr. Kaushik, please.
Good morning, everybody, and thank you, ma'am. Am I audible to all of you?
Yes, yes, audible.
I am sharing my screen. Just a minute.
Sure.
Is the screen visible to all of you?
Yes, visible.
The topic of discussion now is the mentoring in undergraduate medical education. Here in India, we are following the CBAB curriculum, that is competency-based medical education. We have already heard about the need of AdCom in this competency-based medical education, where the humanities are really necessary for undergraduate medical students from the time they enter into the undergraduate medical course. Now, what are the details regarding mentoring? How do we mentor our UG students, our undergraduate medical students, so that when they become the Indian medical graduate, they become a complete, not only a complete doctor, but a complete human being? So, as we all know from this famous phrase, behind every successful man, but I have to change it slightly, that it's not no man. Behind every successful person, sorry, there is always a mentor. Yes, mentoring is necessary, not only for medical education, but in every sphere of life. And medical education is not an exception. See, this is mentor and mentee. Being Bill Gates also require a mentor like Warren Buffett. Krishna and Arjuna. Arjuna has a mentor, Krishna, in Mahabharata. So when we come to the definition of mentor, it's the offline help by one person to another in making significant transitions in knowledge, work, or thinking. This comes from the dictionary, of course. There are other definitions as well: to help and support people to manage their own learning in order to maximize their potential, develop their skills, improve their performance, and become the person they want to be. Sorry. The most important part is the become the person they want to be. So according to dictionary, mentor is a wide and trusted counselor, an influential senior sponsor, a wise and senior person who can guide you. But it's not a complete. The dictionary definition is not complete what we think today. So what requires in medical education mentoring? Why is it required? And how can we mentor our students? Sorry. Mentorship is a process whereby an experienced, not senior, I repeat the word, an experienced mentor gains a strong sense of satisfaction by guiding its junior, but junior in the sense of experience, mentee, to learn, develop ideas, and aid in personal or professional development in an area of interest. So it's a process where an experienced mentor gains a strong sense of satisfaction by guiding a mentee to learn, develop ideas, and aid in personal or professional development in an area of interest. So it's a reciprocal relationship between a mentor and a mentee. between an experienced, highly regarded, empathetic person, that is mentor, and a less experienced junior faculty or a student or a UG student, maybe PG student, aimed at fostering the professional and personal development of the student member. And this is the definition given by the Standing Committee on Postgraduate Medical and Dental Education in the year 1998. So it's a reciprocal relationship. It's not a one-way relationship between a mentor and a mentee. So it's a reciprocal relationship between an experienced, highly regarded, empathetic person and a less experienced student member or junior faculty member who aimed at fostering the professional and personal development of the junior faculty member. So it may be academic mentorship, it may be for professional development, even it may be for personal support. Yes, these UG students, at times, they require our personal support too, apart from academic development and professional development. So when we plot it in the Venn diagram, we can see these three are the essential, and the middle part of the Venn diagram is actually what a mentor should do, that he or she requires to support the mentee personally, guide in his academics, and as well as foster his professional development. This is a true mentor-mentee relationship. What should be there in medical education? The traditional model of mentoring was, it's a godfather model. That is, the mentor promoted and protects the mentee, sponsors and molds his image. That was the previous model known as the godfather model of traditional mentoring or the traditional mentoring model. But nowadays, it's an equals mentoring model. It clarifies, the mentor clarifies and facilitates the mentee. The mentor coaches and builds his image, not molds his image. He builds his image of the mentee. So there are old approach, new approach. Obviously, in India, what we follow today in the CBME curriculum is the new approaches of mentoring. So in the old approach, the mentor selects the mentee, but here the mentee initiates the selection. There was one mentor for one mentee. It's a one-to-one relationship previously, but now it's paired or a group. There may be multiple mentors for one mentee. It was previously career-oriented, and now it's specific goal-oriented, not only career-oriented. Previously, it was the mentor teaching the mentee. Now it's reciprocal learning. We learn from our mentee when we become mentor, and the mentee also learns from the mentor. Even the mentor can be a mentee of some other mentor. So we are, as we know, that we are all lifelong learners. So reciprocal learning in the mentor-mentee relationship is the need of the hour. And previously, this was for the only young faculty, but now all faculty may be mentor, all faculty may be mentee. There is long-term relationship, but now it is specific goal-oriented. There are variable terms of this mentor-mentee relationship. So these are some of the differences between the old godfather model and the new equals model of mentor-mentee relationship. So a mentor should be sounding board, role model, challenger, career counselor, developmental advisor, professional advisor, critical friend, and overall a facilitator. So there are so many roles the mentor has to do. Sounding board, role model, challenger, career counselor, developmental advisor, professional advisor, and overall a facilitator. So there are some do's and don'ts. Mentor should be available, convey respect and confidence, focus on the mentee. Definitely he will ask questions, track progress of the mentee, identify the strength, and give feedback. So, and mentor should promote his or her own agenda, use the spray lever and take the credit. But it should not be like this. I would like to mentor you, the mentor says. You can start by you getting me some coffee. No, it's not like that. You bring me a coffee and then I will mentor you. It was previously. So there is a mentoring cycle. First is building rapport, contacting. You be my mentor. Then comes the productive phase, where the direction setting, progress making, maturation. And the stage 5 is the maturation of the mentor. And at last is the closure. So as it is specific goal oriented, the cycle stops there. So building rapport, contracting, direction setting, that becomes the productive phase. The first one was the clarification phase, then comes the productive phase. He or she makes the progress, becomes mature, and the last is the closure. So these are the 3 phases in the mentoring cycle. What we can see, this is what should be. The mentor nourishes the mentee. The mentor should connect. The mentor should motivate. The mentor should help in the achievement. So this is a hand-holding process. So listen actively, building up the trust, determining the goals and building the capacity, and encouraging and inspiring. So these are the key mentoring skills. So the mentor should listen actively, builds the trust of the mentee, determining the goals and building capacity, and encouraging and inspiring. So great mentors are made. They were not born. We are not born as mentor or mentee. So if we have to be mentor of some of our students, we are made as mentor. No one is born as mentor. So you can see there is difference between the teacher, coach, and now we come to the last part, that is the mentee, a mentor. Sorry, this is the skills competency to the personal development. Mentor plays an essential role in this. So there are so many articles in this regard of mentorship in medical training, shaping the future in medicine. So this is an article from ASRA Pain Medicine, that's a newsletter, where we can see the meaning and significance of mentorship. It's a two-way street. It's not in one way that a mentor guides the mentee. It's a two-way. The pursuit of a career in medicine is inevitably characterized by successes, challenges, and questions every step of the way. So it's a two-way relationship between the mentor and the mentee. So what we follow in our college of Bardhaman Medical College, you see there are so many lists of mentors, and this time we have divided according to the roll number, the mentees. And these are some of the references which I have taken, and it's good for some readings as well as. And some of my slides have been taken from the slides prepared by the National Medical Commission in India. So this is our Bardhaman Medical College and Hospitals where I work. Thank you all.
Thank you, Dr. Kaushik, for your wonderful presentation. Over to Dr. Kiran Kumar Ganji for his presentation, please. Dr. Kiran, over to you.
Thank you, madam. Okay. I will be sharing my screen.
Yes, sir.
Can you see my screen, madam?
Yes. Slide share mode, please.
Am I audible?
Yes, you are audible. Screen is visible. You may start, sir. Thank you.
Thank you. Good morning to all. I'll be presenting this topic. For me is Beyond the Lecture Hall, Unrevealing Social Media Impact on Learning for Medical Graduates. Now, since the start of this session, you have been gone through different sessions like as Dr. Arunima Madam has said that about the qualitative research, then we understood about EdCom model, we understood about humanities, then mentorship. Do you think all these things will occur inside a classroom? So definitely not. So we will try to understand how these all things can be done outside classroom also. So the first question I would like to ask, or my question would be like, do you think students learn only in the classroom? Yes, the answer to this question will be definitely no. Students, they have lot of opportunities, lot of preferences to learn outside classrooms. So in this session, we will be dealing how students learn through social media. So the objectives of this session will be, we will be first dealing what are the available social media tools for use in medical education. I'll be dealing about the benefits of the social media, how it would be helpful for a medical graduate to pursue his learning. I'll be dealing some of the theories of learning which can be fit into it, that it will be an evidence-based, like social media can be an evidence-based tool for learning. I'll be discussing about certain tips of using social media in medical education. And finally, I'll be discussing about the challenges and barriers. So first, introduction part. Now, as we all know that social media is a group of internet-based application. Now, one of the biggest advantage of this social media is its convenience to share. It's a platform where students can share their views, exchange their ideas. They can interact among themselves, and that is what the concept of learning comes into. It is peer learning is being elucidated out of this sharing process. No doubt, medical education is one of no exemption because of this increasing trend of using social media with the help of smartphones, tablets, or any gadget, any technological gadget, which the student is using for teaching and learning. So if you come to the social media platform, what are the different medias available for us? Starting from Facebook, WhatsApp, Instagram, and YouTube. And this is one of the, I need not tell you now I guess the same session which is being streamed live in YouTube is also one of the media where the people are getting the benefit of this platform. So it's a life example like how and learning can be collaborated through social media. So it helps in improved communication and knowledge sharing. Coming to these social media tools which are available in medical education, you might be wondering like how a social media tool can also be used as a learning platform. Definitely, there are different platforms available in the form of tools, starting from blog till the end of commenting. And these platforms are available for different purpose. Now, if you see, there are different platforms in the form of blog. This one of the best example is WordPress, where students can put up some queries, some of the instances, like certain of the clinical scenarios, and different students or even an instructor can also be involved in this and try to give their express their views, express their opinions, express their ideas behind the scenarios which can be complicating or which can be useful for enhanced learning. So this way, the blog is one of the thing which comes in a chronological order in the form of a website presentation to improve the learning engagement. And it also stimulates the interaction with the faculty so that this can be taken into to create a channel or to create an environment to the students for maintaining the humanism, empathy, and enhancement. So this way, a blog can be used. There can be some of the micro blogs also, and that is in the form of Twitter. We all are well aware, like Twitter is most commonly or most useful tool with respect to conference, where any student can create an hashtag with that appearance, and then he can capitalize on the different events which are being occurring and get their opinion. So it creates a back channel in which a participants can disseminate information to provide broader audience, wherein in a single point of time, different broad audience can be combined together and their share can ideas. And this can be created in a virtual network of learners. So the social media is one of the thing. It can be also done with the different networks also. Like among them, the network is the different in the general network can be done with the help of a Facebook. If you want to go a professional network, you can use a LinkedIn. If you want going for a medical network, you can use a Dosimetry. Or you can, if you're going for a research network, you can use ResearchGate. And the not but the least is if you want to share any videos or in a video sharing platform, as we can say it's a YouTube, or we can go for a collaboration with the help of a Wikipedia. And this can allow all these platforms allows a learner to collaborate and create a source of information that is in a structured fashion. And it also helps in creating a mirror with an internal construction of a knowledge. So this bound of actual incorporating the sequential ideas into a fashionable presentation will make learning more feasible, more accessible, more easier, for the students. Sometimes social marking, bookmarking can be also done with the help of a Mendeley. And believe me, some students are believing they have a peculiar talent related to podcasting. They can also do this with the help of a podcasting with use where they can communicate, they can give a message of humanism or interaction with the communication development skills can be enhanced with use of this podcast. And finally, coming to the commenting, which can be used also done with a PubMed Commons. So these are the various available tools which are available for the medical education, which can be done where learning can be facilitated through use of a social media. Now we can go for the benefits of social media in education. Now, social media has a great potential, and this can be done, this potential can be elicited because it involves, shares, and express the knowledge with each other. And this involvement, sharing, and expression is with very ease. Like how it cannot happen in case of normal in a classroom setting where there may be some hesitant to communicate with the instructor or a facilitator, or there may be some hesitate to communicate with the among the peers. But this social media can be an easy platform where without any hesitation, the students can involve, share, and express. So this way of interaction and socialization can be broadly based, and it can be scientifically based on a theory called a social constructivism theory. And this is the theory which is one of the fundamental theory of learning, which helps for the learning and knowledge creation. Now, social media can also be used as a constructive tool where students can have their innovative ideas. They can enhance their critical thinking abilities to build upon their ideas and to create new perspectives of an existing knowledge. So this way, the student media can also be used as a constructive tool to supplement the traditional learning. And this traditional learning can be made more interactive with the use of this social media material. Now, no doubt, there may be some factors which can be entering this, but we should keep in mind that whenever any platform is used, it should be user-friendly, it should be comfortable, and it should be accessible for the students outside the classroom, which promotes the learning and collaborating and exchange of ideas. So when these three parameters are gained out of this, then the learning is enhanced, learning is possible, learning is made easier. On the other hand, we should also make into consideration that educational value of Facebook may also be questioned to what level it is authentic. This is a different issue which is to be dealt. Now, there are some theories of learning which can be elicited out of this social media. Among them, different philosophies of learning regarding social network have been emphasized in the literature. And these have been done by the means of motivation, because motivation is one of the factors which can be initiated with use of social connections. Teaching can be done with collaboration. We believe in intercollaboration. We nowadays we deal with interdisciplinary, transdisciplinary aspects. So this collaboration is possible through by means of easiest platform is through social media. Improvement in learning by immediate and frequent feedback is also one of the things which can be one of the philosophy, which can be a scientific background for a learning process. Engagement is easier through social media. So there are a number of learning theories, all of which are based on several fundamental criteria. And these are based on the set assumptions about learning. They define certain definitions of key terms. They provide specific principles derived from the assumptions that can be tested out of this learning. And finally, they provide an explanation of the underlying psychological dynamics, which of the events can be influence learning. Now, if you go to the social constructivism theory and connectivism theory, this is also one of the two theories which can be incorporated or which can be given a scientific basis for social media as a learning tool for the students. Now, let's understand how it influenced the social, how this social media is getting influenced by this theory. So the first one is connectivism. Connectivism is one of the things. Social media, as you know, it is a means of connecting people around the globe, not only around, in campus, off campus, around the globe. So it explains how technological internet technology can be created and create an opportunities for learning across online peer networks. Students can communicate outside their domain, outside their country to to get knowledge about their cultural differences or what practices are being done, what learning practices are being done at their different levels. So this is how this will. Teachers can also guide students to information and key answers as needed to support the learning and sharing process. Another theory which would benefit is constructivism theory. Now, this learning environment is also considered to be a critical piece of constructive, where the student can build upon their ideas to create a new effective mode of getting a solution to a problem. So whereby learners are provided with the tools and resources to build upon their knowledge and get a new innovative ideas out of their knowledge. So connectivism is a particularly relevant and applicable as a learning theory to inform the use of social media. Why? Because learning is always social, and that is done through connectivism, because we get social media as a means of connecting. Learning is an active process. Believe me, learning occurs in lecture halls, but learning is also an active process which occurs off campus, off lecture hall. So it is learning is an active process. Learning requires reflection. Now, reflection is one of the things which comes more easier in case of social media platform. That might not be possible in a classroom setting, but reflection is easier in case through when learning is done through social media. Learning occurs in a particular context. Now, when we deal with any media being used for social media learning, we deal with a particular construct. So that context is being developed in case of connectivism. So these are all things, factors demonstrate a scientific reason or a basis how social media can be used in theories of learning called as connectivism. Now coming to the tips for using social media in medical education. Now, these are the simple list of the tips. These can be many, but I have tried to list out them to short out. That is, first we need to identify and reflect on what digital identity and goals we are using this social media. We need to identify the appropriate tools also, because if your goal is to teach, we need to find a tool which is better for teaching. If your goal is to learn, share, and collaborate, we need to find a specific platform. So the platform which we choose matters a lot. We need to observe and establish the comfort, because all students might not be very comfortable when they are posting some blogs or this. So that can be done when it can be done with the use of a general statement. So that comfortability is very important in that. Students, there should be some initial connections, because it cannot occur at a stretch. There should be some initial interactions, and that gives a starting induction for the students to get involved into the further interaction. There should be some apply, students should know and apply existing media guidelines responsible for use of social media. They should develop individual guiding principles also. And more important is, any patient information should not be shared. It should be shared, it should be masked, and it should be kept private, because consent is very important. Sharing someone information is very critical issue, which is easier because sharing is very easier. So that's why we should keep all patient information very private. Then sharing the credible information and disseminate evidence-based information is also important in enhancing the public health. And finally, there is another tip that is to be taken consideration is engage, learn, reflect, and teach. This is the principle which you need to follow, that we need to engaging ourselves as a learner, then we can reflect it, and at the same time, we are teaching among them. It's like a two-way process where a fast learner or a slow learner, both are in the same group. Fast learner can learn, can teach a slow learner, or a slow learner can also be a mentor or a teacher for a fast learner, maybe in some instances. So this is how the principle of listener. Then advance your academic productivity by expanding your professional network. And finally, mentor and mentorship. As one of the professor previously in session, we understood that what is the beauty of being a mentor and a mentor mentee, that also can be done using a social media platform. Then finally, coming to the last component, that is challenges and barriers in use of them. There are definitely a lot of challenges. Technology as it is also a hurdle, because it can be an addiction. Addiction of a social media sometimes acts as a distractor and divert attention for the students. To mention another important thing is cyberbullying. This is also one of the severe adverse effects that can affect the behavior of a learners. It can cause detrimental effect on the psychological impact by this process. Multiple concerns related to workload, like sometimes time constraints may be one of the factor for the students to get involved in this social media platform for a learning process. Privacy and integrity, yes, this is also one of the important things which has to be maintained. This is also a challenge to control the privacy of any patient's perspective. Lack of interest in the peer feedback. Sometimes students, they don't, the peer feedback is very important for the peers to get and learn about their existing that reflection part. So that interest has to be developed. That is also one of the things which is a challenge there. Lack of appropriate training, multitasking, doing a different task, and managing social media content is also difficult. And students who use social media extensively feel difficult in face-to-face communication. So these are the list of the challenges and barriers which can be illustrated out of social media when used in the medical education. Coming to the conclusion, social media is a powerful instrument for social interaction, and is also used for a tool for teaching and learning. The extent to which these tools are supportive for academic activities and learning experience demand a robot evidence. The current technology-driven era, use of social media and relevant gadgets, tools, and application acts as a mandatory requirement for a medical education. Thank you for your patience.
Thank you, sir. For your wonderful presentation. Over to Dr. Karthika for her presentation, please. Karthika, madam, over to you.
Thank you, ma'am. I first thank the organizers as well as Arinima Chaudhary ma'am for giving me this opportunity to present in this platform. Shall I share my screen, madam?
Yes, ma'am, please start.
So today we'll see about the ethics for educators, research and publication under the following headings. So the schema of my presentation includes Code of Ethics for Educators. We'll see about educational research, types of educational research, principles in ethical teaching, ethics in research and publication. Code of Ethics for Educators. It includes honesty. So the researcher and the educator should be honest and dedicated and should be reliable enough. They should respect the privacy of other members, thereby maintain the confidentiality. They should be aware of the roles and responsibilities and know about the student needs and their aspiration. Not only that, there should be care and love and respectful relationship with the students. They should be trustable, make the professional growth continuous through research and disseminate the same through publication. They should also keep away from the conflicts between the professional and private work that can affect the student's perception. So what is educational research? It is the application of scientific approach to the student's educational problems. So it can help in adding knowledge to the existing gap, to improve the practice, to recommend different methods of teaching and learning, to establish a relationship between the variables in education, or to establish educational theories. As already discussed by Madam, the types of educational research, it can be of different types based on Association of Medical Education of Europe, which can be explorative, experimental, observational, or translational studies. So what are the various principles for educational researchers? They should be content competent, pedagogically competent, and while dealing with sensitive topics, what are the ways they have to deal with? They should concentrate on student development, dual relationship with the students, how to handle it, and confidentiality in all the way has to be maintained. Respect for the colleagues and assessment of the student should be done in a valid way, and there should be also respect for the institution. So these 9 principles were developed by Society for Teaching and Learning for Higher Education. So according to this, what is content competent? So the instructor researcher has the right and responsibility to analyze the course activities as well as educational values and makes it more content competent enough. Not only that, he has to make it more pedagogically competent, the way in which he has to teach. So the primacy of teaching and learning, the content should be aligned with that of the institutional, disciplinary as well as professional expectations and obligations, and so that making the student more competent and should concentrate on the development of the student. While involving them in the research activity, the educational value should be there, and that should be associated with your course outcome. When the different instructional approaches are tested in the research, it cannot be done in the way of RCT, as it is unjustifiable and against the student development, as part of the students is not exposed to the approach. So confidentiality can be maintained for submission of research activities. It can also be hidden among the peers. Students should not feel excluded based upon their decision to participate in the research, so their assessment should be proper. And the research participation should not affect the course grade unless specified in the syllabus while starting of the course. And concealing the participant identities from the instructor or the researcher is of highly important in order to prevent the power over relationship. And while dealing with sensitive topics, example, study on sexual or domestic violence, it is better to make the students understand what is the importance of doing the project and how it is important to make a conclusion. Respect for the institution. Consider the extent to which the identity of the institution or the program or the community should be protected. And the data ownership and access, the researcher need an informed consent from the individual or an organization whose data are used for research project, and they have to gain the permission from the official data custodian. For example, the registrar in case of any medical institution. Though we are teachers, we can use the students' marks as a data. It is mandatory to get the permission from the data custodian. So thus, the educators have the freedom, academic freedom, that can be used in their research, but it is of more important to protect the privacy, confidentiality, and seek the free and informed consent from the participants, respecting the participants and concern on their welfare and provide justice to them. So the various ethical guidelines for educational research put forth by British Educational and Research Association includes responsibilities to participants, responsibility to sponsors and clients, and what are the responsibilities to the community, what about publication and dissemination, and the responsibility for the researchers. Responsibility to participants. We have to respect the participants and make them active or passively involved. What is passive involvement? Passive involvement is that the researcher's identity and their academic intention of doing the research can be partially or fully hidden from those involved in the study. And the social media participants, tracing of these social media participants or using of data from the social media of any organization has to be used after getting the appropriate permission. And research outcome to be shared to all the participants after their completion, and any research should be done with utmost beneficence by preventing non-maleficence. And the researcher should be competent enough and responsible for the participants in his research. And the consent, which is of utmost importance for doing any type of research, it should be of voluntary. It should be of informed consent, unrestrained consent after complete explanation of what are the protocol or the plan of the project or any research. Consent from gatekeepers. Gatekeepers are those who are the custodians of the students or their own data. Consent for online data has to be obtained from the data creators. Consent for using the data for secondary purpose or reusing the data has also to be obtained. Thus, consent is not a one-time process, it is an ongoing process. And consent in case of ethnographic or any observational or large-scale randomized trials can be made possible by increasing the sample size so that those who are not at all giving the consent the sample size can also be matching if we are aiming at a larger sample size. And it is also important to get the consent from the children, from their legal guardians, as well as assent from the children can also be obtained as per the ICMR guidelines based upon the age of the children, which can be oral or written assent. Thus, informed consent in educational settings should follow hierarchy of gatekeepers, and age of the students and their disability has also should be considered while involving them in any type of research. Confidentiality and anonymity, however, has to be maintained, and it is the participants' inherent right and wish, not be overridden by their formal powers of authority. And educated consent, not only informing everything about the research, they should be educated about what is going to be done, what is the purpose, what is the end result, what is expected. And sometimes it is mandatory to get consent from the loco parentis. What is loco parentis? Those who are temporarily in, like, for example, teachers who are while the students are inside the classroom, those teachers, they act as like that of the parents, and they are responsible to give consent for the researcher to make the students get involved in any type of research. They should maintain the transparency, and they should also maintain the honest or the non-disclosure, and non-disclosure should be mentioned in any type of research. Information about the sponsors has to be informed to the participants. Denying research that has conflict of interest is the right of the participants, and they have the right to withdraw at any time of their participation. Incentives can be provided in a good sense, and harm arising from participation in research can be minimized and managed, and any distress and discomfort that arise out of participation has to be taken care of by the researcher, especially among the vulnerable population. The privacy and the data storage should be, it is in the hands of the researcher. They should be confidential, and the data should be treated anonymously even while doing analysis. And disclosure about any type, like for example, if we are obtaining the data from any social media, so the disclosure has to be made, and it is mandatory in spite of the confidentiality where we have taken the data has to be mentioned. Ethics in social media research. Situational ethics principle can be followed if we are using social media as a part of our research, or in collecting data if we are using the social media. So participants must be clearly informed that their participation and interactions are being monitored and analyzed for research if they are social media participants. Identity presented by the participants may not be true in case of online media. Anonymity is also harder if they are truthfully mentioning their identity. And potential for harm if we are giving any sensitive data, and if it is published with identity without consent, it can give harm to the participants. So perception of the online community about the data, whether it is a public or a private account, has to be first made clear. Then the public user data can be used without getting their consent. However, if the data are vulnerable and sensitive, it is mandatory to get an opt-in consent. But if the data is not vulnerable or non-sensitive, you can go for opt-out consent, wherein if the participants are not neglecting or they are not giving any opposition in participation, it means they are giving the consent to participate. So the rights of the individual should be balanced against the social benefits of the research, and it is the researcher's right to conduct research in the service of the public understanding. Researcher can use appropriate ways to make contact with online communities and to get the consent. What are the responsibility to the sponsors, clients, and stakeholders? The stakeholder of the research is considered to be any person or a body who has a direct interest in framing and success. So written contracts and agreements with the provision for negotiating changes has to be made before starting of any research. To reveal honest and complete details of their competence and capacity and the method of study chosen, everything has to be mentioned to the stakeholders. And ensure robust data collection method, analysis method, and inferences. Acknowledge the sponsors as well as participants. What are the responsibilities to the community of educational researchers? All those engaged in educational research should maintain their integrity and reputation. They should enhance the critical analysis and constructive criticism that generates improvement in practice and enhancement of knowledge. They should not criticize their peers in a defamatory or unprofessional manner. Communication detail has to be mentioned in the publication. Thus, researchers have the duty to consider and respond for complaint on malpractice. Suppose if any researcher is found to be with plagiarized in any of their publication, they can be contacted in writing, ideally by enclosing the evidence of those documents. If the researcher is not responding, then it is the duty of the person to contact the author's institution. The participant or the researcher especially, they have to be aware of the copyright while using the digital content in their research. They should also be knowing, they should also have knowledge of what is Creative Commons licenses, how the documents can be used in those domains. They should allow for external scrutiny. If confidentiality and anonymity are breached, and also to assess the quality of the research that they have undertaken. Negative results of interventions and evaluation should also be reported, and they should not manipulate their results. During recruitment of student research participants, strategies can be followed that can prevent the instructor researcher knowing which students are participating. So that can prevent the bias, as well as that can prevent the relationship between the student and the teacher. So student can act as a partner that can enhance the anonymity among the other participants. So instructor, researcher, so making a dual role of a teacher in an educational setting can make them to experience conflict of interest that can be avoided. And confidentiality has to be maintained by using anonymous data by the researcher. So what are the responsibilities in case of publication and dissemination? So researchers should communicate their findings and their practical significance in a clear, straightforward fashion and in a language understandable by the intended audience. It can be published in a local language too, if the audience we prefer are in such a way that they can understand in their own language. And we have to prefer, the researcher has to prefer an open access publication which has the Creative Commons license. And commercially sensitive results may remain confidential based on the wish of the sponsor or the institution. So do not falsify, distort, or suppress or selectively report any sensationalizing report. And authorship based on substantial contribution should be given. What is substantial contribution? According to ICMJE guidelines, they have to contribute in conduct of the study, conception, designing, as well as in data acquisition, statistical analysis, interpretation, drafting, and revising of intellectual content, and approval of the final version. So responsibilities for the researcher's well-being and development. The researcher should also feel safety while doing their research, especially in a remote area while doing any field work. So the employers are responsible for supporting the researcher's personal and professional career development. So now we'll move on to the publication ethics, where ethical approval is must, whatever may be the type of research. Even in case of educational setting, educational research, ethical approval is must. So author must not use words, figures, and ideas of others without any attribution. If so, it can result in plagiarism. And they have to avoid duplicate submission. However, articles based on the content which are previously made public in case of a preprint server or in an institutional repository, or if it is a thesis of a PhD student, it is not considered as duplicate. Redundant publication or salami slicing should be prevented. That will also result in self-plagiarism. They will self-cite their own project. So that has to be avoided. Citation manipulation, where the editor or the peers, where they'll ask their friends or the journal's own publications to be cited in the publication what it is we are going to submit in that particular journal. That has to be avoided. And the data has to be accurately presented without any fabrication and falsification. Where fabrication is that we are cooking up the data, which has to be avoided. And falsification is that where somebody is changing the data or making the data which suit the result. That has to be avoided. So author contribution should be mentioned, and conflict of interest has to be mentioned in any of the publications. So thus, we have seen about the various, what is educational research, what are various types, as already mentioned, and about the ethics which has to be followed while we are taking up any educational research and we are publishing it in any of the domains. Thank you.
Thank you, ma'am, for your wonderful session. With this, we come to an end on the session on medical education. Thank you, APAN organizers, on behalf of all participants. And we end our session with this. Thank you all.
Thank you, ma'am. Thank you all.
Thank you, ma'am. Thank you all.
Thank you, ma'am. And thank you, everyone.